Hello again, friends. Jamar Doyle, President and CEO of CHHSM, the Council for Health and Human Service Ministries of the United Church of Christ. And I am so pleased to be joined today by Syria, who is the President and CEO of EveryAge in North Carolina. Thank you so much for joining us today.
Thank you for having me, Jamar. I'm excited to be here.
Can you begin by just telling us a little bit about yourself, why you chose to go into the field of senior care, and then perhaps lead into what makes EveryAge special for you and for the residents that you serve?
Sure. So, to be quite honest, I really had no idea that I would be in senior services when I was going through college, and I kind of fell into it. My background for undergraduate was under healthcare management and a business administration degree. And my concentration when I did my internship was in finance. Discovered quickly I did not want to be doing finance. No offense to any of the financial professionals out there. But I fell in love when I did the rotation through various departments at a hospital for my internship with human resources and working with the employees and engaging the workforce and the variety that comes with that. So when I was getting ready to graduate, I was looking for a job in healthcare and human resources. And, parents are like, I was the youngest of three children. So my parents were like, just get a job because
Hmm.
then they're out. They have all their kids out of the house and no longer dependent. So got an offer for this senior living organization. I didn't even know what a continuing care retirement community really was when I came for the interview. So I was thinking I was coming to a nursing home for an HR manager or coordinator, some title like that, and interviewed and didn't even know it was in Newton, North Carolina. Grew up in Raleigh, which is the capital, larger place. So Newton's a small town northwest of Charlotte. Didn't even know where I was going for the interview. Got here and they offered me the position, and I talked to my mom and I said, I don't know about, taking the job. And she said, I'll tell you one thing, it's better to find a job if you have a job. So give it a try, see if you like it, learn as much as you can. And if you don't like it, then you can always look for something new. You're still young. Best advice I've gotten because
Hmm.
I've been here now, it'll be 27 years in June. So once I think most people think about working with older adults or in a nursing facility or long-term care, senior living, you think, oh, I mean, I get asked, how can you do that? That has to be depressing. You see people at the end of life. It's exactly the opposite in a lot of ways. And especially in an environment like a continuing care retirement community, because we get to see people like when they're still active, independent, and then get to know them. And then as they age, which we all are doing every day, we get the privilege of serving them as they need more assistance, but we knew them before they became that dependent. And I think that gives us a real special privilege and insight to them. So, yeah, I wasn't planning it, but this is apparently where I was meant to be. So,
It's so funny. In my background, it's something similar where, for the longest, I grew up thinking I was going to be an architect. And I'll just say I had an internship in an architecture firm, realized pretty quickly architecture was not in my future. I did not want to sit at a drafting. I'm old enough that it would have been a drafting table and not AutoCAD. And I was like, I do not want to do this, but found really what my passion was. And so those experiences, both good and bad, do help shape it. And, I love that you talked about how being at a continuum of care location really helps shape, what that experience is in terms of working with seniors and working with people when they're both active and also being there as they, begin to mature and maybe perhaps are not as active. Can you talk about one, in case some people don't necessarily know what a continuum of care is, like what that is and how that plays out at every age, and then how that also kind of fuels the way in which you care for the residents that are there at every age and at your various properties throughout North Carolina?
yeah, so sure. So many people call it, we're licensed as a continuing care retirement community. We have three of those. We have other programs for older adults as well.
Mhm.
But we started as a rest home that grew into a what you call CCRC, or continuing care retirement community. Some areas of the country are using the term life plan community as well, so you'll hear those interchangeably. But it's typically a community where you have all levels of care for older adults. So ours campuses are for people that are 62 years of age or older. They move in typically in independent living or residential living. It could be an apartment, a freestanding home that we call a cottage, or a villa, which is like a duplex. They live there until they may need a higher level of care. And then on this same campus, we have assisted living, and we also have skilled nursing care, which in skilled nursing, they can have short-term rehabilitation services. We have memory care or memory support as well. Some people offer that in assisted living level, depends on the area of the country. And then also long-term care if they, need it for a longer period of time. So they are able to transition through the continuum as their needs change. And just like if a person may go into maybe in our residential living or independent living, have a short-term need, go to the healthcare center, rehab, and then go back to their independent living unit. So it really just offers that assurance and ability to, as your care changes, that you can receive the services where's most appropriate for you at that time. But the beauty of it is you're still within the same campus, you're still within the same care providers, the people who are, providing services across the community. So it's not like if you're living out in your home out in the wider community and all of a sudden you get faced with having to go to a nursing home and you don't know anybody. It offers that assurance and that, just a better way as you get older and you want to have a plan and you don't want to be surprised. So we have three CCRCs at EveryAge. The one that I first joined when I began working here, Abernathy Laurels, which is in Newton. And then we have one in Thomasville, North Carolina, and then one in Suffolk, Virginia. And so the footprint of EveryAge really aligns with the Southern Conference of the United Church of Christ. So a lot of people ask me why we have one community in Virginia, in southeastern Virginia, which is about 5.5 hours from where we started in our home base. And it's because of our connection with the United Church of Christ and our foundation. I may have digressed a little bit from what your original question was.
No, you know what, you read my mind. That was the perfect segue because I was going to note that that EveryAge has a 50+ year history that started sort of with a connection from the United Church of Christ. So maybe talk more about your history and the locations you serve today. And I think I saw on the website over 2,000 individuals served, I believe. So maybe just talk about that history and who you serve today.
Sure. So as I said, we started at 1971 is when our first program opened. I think it was the late 50s, early 60s that a group of individuals and churches, congregations within the Southern Conference began dreaming of creating a place, a community for older adults. And so that one community in 1971 opened up as what they used to refer to as a home for the aged, more like a rest home, grew into the continuing care retirement community that I just spoke of. And then over time, the desire was to continue to grow our organization. Before I go on with our new programs, I should say EveryAge started, its original name was the United Church Retirement Home, and it's had a few name changes over the course of our history. For a long period, it was United Church Homes and Services. And then for our 50th anniversary in 2021, we renamed to EveryAge, although the governance and our affiliation with the United Church of Christ and everything has stayed the same. So as we grew our programs, we opened our second CCRC in the mid 80s. And then in the 90s, our board really looked to how they could provide services outside of the continuing care retirement communities and provide for a wider span of serving people within the socioeconomic spectrum. And so we began to develop our first HUD 202 affordable communities that provide independent living apartments for seniors ages 62 or older. We have 7 of those apartment communities across North Carolina. And then in the, I guess, mid 2000s, we began to think about future diversification, still with the aim to serve older adults. And we discovered the program for all-inclusive care for the elderly. And that is a program whereby we have two of them now, one in Lexington, North Carolina, and one which we affiliated with in 2020 in Wilmington, North Carolina. But it provides services to individuals who may otherwise need to be in a skilled nursing facility, but with our supportive coordinated services, they're able to remain out in the wider community for a longer period of time. So over that course, as you said, I think last year, our last fiscal year, we served over 2,700 older adults. And then we employ just under 1,000 employees at this point. When I started 27 years ago, we were just two CCRCs and one affordable housing, and we were working on the third CCRC. So we've seen tremendous growth since I've been here. And obviously, I didn't come in, I mentioned earlier, as the CEO. So I won't take credit for all our growth. That a lot of my predecessors had a lot to do with that. But it's been great to watch and see this organization evolve.
Just hearing that, it makes me wonder, what would you attribute that growth to? Because that is phenomenal, in that amount of time, 27 years going from, I think you said two CCRCs and one affordable housing community to, now seven affordable housing communities, and there's, additional growth and three CCRCs. Just, what do you attribute? What's the special ingredient in the secret sauce that attracts people to EveryAge?
Yeah, I think, the strong governance from our board of directors and a board that has been visionary and not hesitant to try new opportunities to serve seniors. I mean, going into affordable housing when all we knew before was CCRCs, and then with the PACE programs, saying, well, this is a model that we could serve a lot more people for a lot less startup costs than bricks and mortar. So trying to think of ways that we can continue to expand the services with maybe outside of the box, not always the bricks and mortar, which is a lot of ways that, you see the services going to for older adults at this point, especially with technology, and everybody's trying to capitalize, I think, on the wave of, the baby boomers turning, 70 and now 80 and that type of thing. So many technology companies trying to get a handle on that. But it really started with, how do we serve people beyond, four walls? And when we talk about our mission at EveryAge, and our official mission statement is that we're a Christian ministry committed to providing vibrant living, diverse programs of outreach, and compassionate services. But when I really think to boil that down to what we actually do, and it's kind of like a light bulb went off after COVID, it's really about creating community, either, and not physical community, but community also within our programs. So just because you hear so many people, studies have shown people actually living in a physical community in senior living fared better than some living in the wider community because of the isolation. And I do think that's what we do really well, either if it's through our bricks and mortar community or our PACE program, which really isn't, 24/7 operation where people are physically in a space together, but we're still creating community among the people that are served there, the participants. And I hear them say that.
What are some of the things that, and I love that you said there's the brick and mortar community, but then there is actually creating community. There's the, I think the intentionality that happens on campus. So, if someone were to be at one of the EveryAge campuses or communities, what are some of the programs and services that are part of building that community at that location? And what are some of those things that you guys offer?
Yeah, I think a lot of it's through our life enrichment departments and tailored to each of our specific communities or programs as to what the individuals either living there or that are participants, in the case of PACE, want to do and partake in. So a lot, can be wellness programs. We have fitness classes, from yoga to Tai Chi to aerobics, swim classes. We have outdoor walking trails that people participate in. We have um, different type of volunteer programs. We have resident-led, programs that they actually host. We have a lot of residents that come together to provide support to outside not-for-profits, doing food drives for local food pantries and getting involved in the wider communities as well. Our participants at our PACE program, they love to do crafts together. They sew, and they like to be able to do that, to be able to give to others who may not have access to those things as well. So it's interesting, though, when I go to each of our campuses, how the programming can change based on point in time with who's living there or who's being served there at that time. We also have a very robust spiritual life programming at each of our communities that offer not only, traditional Vesper worship services, but Bible studies. We employ directors of spiritual life and chaplains to lead those programs, and then also, have volunteers from the wider community help us with those as well.
I love that you said that it's there's that flexibility that each community, the programs that are offered are really sort of tailor made to not just the community needs, but then also who's living there at a time, and that it may change depending on the makeup of the population and the needs of the folks that are there. And so to me, it says that there's an intentionality at every age to be really in tune with the residents and also the participants of programs like PACE to make sure that they're active, they're engaged, and that they're really connected to every age in a deep and meaningful way. And I am sure that that would resonate with a lot of the folks that are listening to this video. And I'm wondering, what are ways in which maybe they can get involved or make a difference? I hear you say that there are some connections to the community, such as being involved with the local food bank. Are there opportunities for folks, if they're in the North Carolina area and are engaged and just want to learn more about every age and perhaps either get involved? How would they do that?
Yeah, we absolutely welcome volunteers who want to be involved in our organization, from, helping us with life enrichment, hosting activities, setting up for that, to some help with our, clerical stuff that needs to go out, some help with sitting with individuals who in our long-term care who may not have as much family support. So there's a variety of different avenues, but the best way is to go to our website, which is www.everyage.org, and connect that way with us and contact either our life enrichment directors at a campus that's near you, or through our EveryAge Foundation. They can coordinate you and get you in touch with the most appropriate person or community near you if you're looking to do that. So.
No, that's great. And so, and hearing that it sounds like there's a wide range of volunteer opportunities, be it if you want to sit with and connect with a senior and a resident, or if you have clerical skills, there is whatever your skills and talents that you would want to bring to an Every Age campus, there's something for you. So www.everyage.org, I believe I said that right. If I didn't, you certainly can click the QR code at the end of this video, link to CHSM's webpage, and you'd be able to, through our Find a Provider, link with all of the Every Age locations. So if something has pricked your heart, absolutely reach out to them through the website, connect with Every Age, and offer your skills, your gifts, your talents in a meaningful way. And they're spread throughout most of different locations in North Carolina and also Northern Virginia. So if there's a location near you, absolutely get involved. Lee, is there anything else you'd want to share with the folks listening to this video today about Every Age and the work that you all do?
Yeah, if you'll allow me for just 1 minute to share, one of my favorite programs that we have is,
Absolutely.
which is not one of our formal communities or like a PACE, but it's our Grant a Dream program. So we have a program, and it's kind of a play on Make a Wish, but it's called Grant a Dream,
Mm.
that we work to make the dreams of individuals that we serve come true again. So we have had some fabulous stories and opportunities to make people have the be able to relive something in their past that they may have experienced and want it to do again. We had a preacher's wife who wanted to ride on a motorcycle, and when her husband was alive, he wasn't he didn't want that to occur. But we made it happen, and we had the video, and that was great. We had a memory resident in skilled nursing who always talked about her days in high school being a cheerleader. We had the cheerleading squad from her actual high school come and perform for her. And the spark in her eye, now the next day she may have not remembered it at all, but her family was there, and I know they remember it. When she all of a sudden took over as she was part of the squad again and told them, "Let's go, team," and started reciting the high school cheer, was so
Wow.
doing those type of things is when people say or ask me, "Why do you do what you do? How could you stay there 27 years?" It's things like that. It's making the difference in the lives of those that we serve. And it's usually the little things that have the biggest impact. So that's what I would, say to anybody who's thinking about working in a ministry that serves older adults. You can have a significant impact on an individual with very little effort. So,
I love that story, and I can't think of any better way to end it. Talk about making a difference in someone's life. Uh, that's such a blessing in terms of what you're able to do through that program and really make those dreams come true for your residents again. What a blessed opportunity. What a blessed place to work at. And just to be able to be a blessing to someone else and how that also feeds your soul. I just thank you so much for sharing that story. I'm glad you you raised your head and said, "Let me just share this one more." I can't think of a better way that we could have ended this conversation. So again, if anything in this conversation has excited you and you'd like to reach out, maybe even just to donate if you're not able to, maybe be able to volunteer time, but maybe you're able to volunteer and offer some treasure, please reach out to Every Age. Again, www.everyage.org. Lee, thank you so much for this time. Friends, this has been a wonderful conversation. Join us every month where we'll highlight a different Chisholm agency. And as always, you can scan the QR code at the end of this video to sign up for our Diacme newsletter to make sure that you don't miss one of our Ministry Moment segments. And you can also, on our Find a Provider page, link to all of our different Chisholm agencies. Be blessed, and we'll see you next time. Thank you.
thank you.